It's in the news, it's everywhere, it's in your town. You know,
and people have to realize that it can happen to them.
It can.
Because it happened to us, and
you know?
Parents don't think it's going to happen to them.
No.
Our children didn't think it was going to happen to them. The community, everybody just kind of sweeps things under the rug, and it can and it does. I mean, it happened to us.
It does.
Welcome to Knockout Opioid Abuse. I'm Michael Hill. You just saw a short clip from a film produced by the Partnership for Drug-Free New Jersey called Moms Know Best, a crucial message for parents. In that video, several middle-class families and mothers talk about their very painful experiences with opioid addiction and their children. The opioid abuse epidemic has gripped New Jersey, and we're losing more and more residents every day to the disease of addiction. Since 2004, more than 6,000 people now have died in New Jersey due to heroin. The newest data shows that overdose deaths rose 21% in the past year. Recently, the United States Surgeon General, Dr. Vivek Murthy, issued the first ever Surgeon General's report on alcohol, drugs, and health. In this report, he outlined these facts. More people use prescription opioids than use tobacco. There are more people with substance abuse disorders than people with cancer. And substance abuse disorders cost the United States more than $420 billion a year. Armed with this information, my guests today are here to discuss a new outreach approach the Partnership for Drug-Free New Jersey and the Horizon Foundation for New Jersey have developed to use that knowledge to address opioid misuse and related consequences across the state. Marianne Christopher, Vice President of Clinical Operations, Horizon Blue Cross Blue Shield of New Jersey, and Angelo Valenti, Executive Director of the Partnership for Drug-Free New Jersey, are both here to talk to us about a series of town hall meetings that will take place in every region of the state. Angelo, tell us about this outreach. The Partnership for Drug-Free New Jersey and the Horizon Foundation have come up with. Tell me about this.
Yes, Michael, first of all, thank you for hosting this very important program. The Partnership for Drug-Free New Jersey and the Horizon Foundation of New Jersey have actually been working together for many years in bringing information to New Jersey's communities, parents and children about how important it is to become aware of the dangers of substance abuse. So just recently, we decided to come together to organize a statewide initiative where we can bring this very important message to the local level through a series of town hall meetings and focus on the issue of opiate abuse, which has become the #1 public health issue in our country.
Wow. Marianne, tell me this. Why town hall meetings?
Well, Michael, the reason we went with the model of town hall meetings is because this situation will only be addressed if we really understand what the perspectives of the community and community members are. And so we were fortunate to have this long-standing relationship with Angelo, as he said, and so the Horizon Foundation of New Jersey, our corporate arm, philanthropically, will be making a grant of $250,000 to the Partnership for Drug-Free New Jersey under Angelo's leadership. We know that the only way to address the issue of the opioid crisis in our communities is to really look at the model of social change, because it's a social issue. And so the only way to really affect social change is to ensure that communities have a voice. And so we're delighted to have this opportunity together to go to communities throughout New Jersey to understand the unique variances in frankly, the issue, the concerns, the challenges. But Michael, where it's really exciting, we're also going to build on the assets of communities and build our recommendations around what we hear from people who live in those communities and deal with this issue every day, at home and at work.
Marianne and Angelo, based on what you're saying, Marianne, is that you're looking to learn from these communities and these regions across the state as much as you're willing to, and you plan to give information and share information.
Yes, and that's such an important point, Michael. It is about really listening, hearing, understanding not only what the concerns are, but what the recommendations of lay people are as they struggle with this issue. And this notion of involving community comports exactly with the Surgeon General's report on addiction. So we're delighted to have this opportunity together.
Angelo, give me an idea. What are you expecting to hear?
Well, we're hoping that this is an opportunity to really showcase some of the great examples of programs that are working at the local level and be able to use those as ways to be able to share with other communities. We know that there are so many great programs that are happening in the states in the state of New Jersey and happening at the local level. So we think it's a great opportunity to be able to bring those programs, share those programs, and use best practices as a great way to be able to deal with this issue.
And when you talk about programs, Angelo, because you're so much about prevention, you're looking to hear more about prevention from different regions as well.
Absolutely. We think prevention is obviously a key component in addressing the opioid epidemic. We have to stop it before it begins. So prevention is going to be paramount, but we also are looking at ways to be able to help people that need help, families that need assistance, certainly look at ways to be able to identify individuals. We're looking at stigma as a stumbling block for getting assistance. So there's so many different components of this issue that will be discussed during these town hall meetings.
Mary Ann, the U.S. Surgeon General, if I read this figure correctly, abuse disorders cost the United States more than $420 billion a year. We can't continue to go on like this.
No, we can't, and that's the quantitative figure. And then when you add to that the impact it has on quality of life of families, what the impact that it has on employment, on academic preparation and achievement, it just magnifies that number. So yes, Michael, we have to really address this together.
Angelo, your thoughts on it?
Well, I think also what needs to be addressed at these events, which will be addressed, is that this is an issue that affects everyone in the state of New Jersey.
And we've seen that.
Yes. It's not a suburban issue, it's not a rural issue, it's not an urban issue, it's an issue that crosses all demographics. So I think it's important to be able to bring people from different parts of the state together to share their experiences, to share their knowledge, and to be able to really get some insight from how this is being approached at the local level, and once again, to be able to look at that as a model for the rest of the state.
And Angelo, more to your point, the video talks about middle-class moms. Those three words right there tell us something about this epidemic.
Yes, for many years there was a disbelief or not even an understanding that this is an issue that can affect anyone, no matter what your economic background may be, no matter what community you live in. And what we're finding now is that more and more people are becoming aware of that. I mean, there are still a great segment of the population that don't understand the specifics of this issue. In fact, we conducted a survey recently of parents of middle school children in New Jersey, and a third of those parents still didn't see the connection between prescription drugs and heroin abuse. So there's a tremendous opportunity for sharing this information and getting people to become much more aware of the roles they play in helping to protect their families.
Wow. Mary Ann, what do you think of that? I mean, this is not just about any one segment of the population. We're talking about, as Angelo mentioned there, and as we've seen the statistics bear this out, this involves everybody.
It does involve everyone, and so the solution also involves everyone, Michael, which is why we've taken this community-based approach to moving forward. As Angelo said, we'll build on the best practice models that we see in these communities. We'll socialize them across the state, and we'll join hands with all of the sectors, all of the stakeholders, centered first on the patient and their families so that we can make a difference.
The statistics, are they disheartening to you at all, Angelo?
Well, I think the statistics are concerning, but what's disheartening and really concerning is when you start to meet with the families that have been impacted on an individual basis. And I think it's easy to look at numbers, but when you look at an individual family, and we have hundreds and unfortunately thousands of families that have been impacted, I think it really demonstrates the need to be able to do everything and anything possible to be able to reverse these trends and really deal with this epidemic head on. So I think that really is much more of a concern, the individual families that are being impacted throughout the state.
Good. Much more to do on this. Thank you very much. Now, when we come back, we'll be talking with other New Jersey experts. But first, here is another excerpt from a very important video called Moms Know Best.
It's happening in suburbia. I mean, it's a new face. It's a new face of addiction now. Our kids are the new face of addiction. They're beautiful, handsome, well talented, right, creative, good families, the typical, your typical child. And they're dying. And they're dying
in vast amounts, grave amounts.
Too much.
Rapidly.
And, we're losing too many kids, and it's the same story, with all these people in my group. They come and they share, and it's the same story, just that the names are changed. And it's a boy or it's a girl, but it's the same wonderful, beautiful children. And they're all they're all dying.
We're back, and joining Angelo Valente, we have Senator Joseph Vitale, chair of the New Jersey Senate Health, Human Services, and Senior Citizens Committee, Dr. Lewis Nelson, chair of the Department of Emergency Medicine at Rutgers University, New Jersey Medical School, and Ocean County Prosecutor Joseph Coronado. Thank you very much for joining us.
Thank you.
Dr. Nelson, let me start with you. How did we get where we are in this epidemic?
So there's actually a lot of blame to go around. I mean, there's, if you look at this going back to really the inception of the epidemic, it goes back to somewhere in the mid-'80s, when we really started to look at how we managed people who had chronic pain. I mean, there really was a very small problem with chronic pain back in the 80s, and it was the sort of thing that, you would rarely even hear about. And then all of a sudden, we recognized that that pain is a syndrome that could actually be managed by using long-term treatment. And at that time, or before that time, nobody would ever use opioids for more than a couple of days. And on the basis of a couple of papers and a couple of studies, doctors started realizing that you could actually start people and continue them on long-term opioid therapy, safely, but not necessarily effectively. In response to that, advocacy groups and pharmaceutical companies and regulators and others have come out in support of better and more aggressive pain management. That led to the downstream implications, such as people developing worsening pain syndromes, people developing addiction and substance use disorders, people using too much of their pain medication, in part because it makes them feel good, people using too much of their pain medication and overdosing on it, and ultimately it led to this epidemic we have now of addiction, right? And all of the implications associated with it, which includes diversion and everything else. And that's pretty much how we got here. So there's really no easy answer. You can't really say that there's one problem that could have been avoided to get us here. It's really a multifactorial and very complicated answer.
And Senator Vitale, you've heard what Dr. Nelson said. What are you and your colleagues in the legislature, what have you done, what are you doing about this?
Well, about 3 years ago when we saw this starting to balloon around the state, I put together a group of addiction experts and folks on law enforcement, but lots of public health types that truly understood the addiction issue, understood what the issues were and how to address them. And so as lawmakers, we thought that there was a way that we could develop a legislative strategy to address this epidemic from 4 different perspectives. One was prevention, education, the other is treatment and recovery, so that we're sort of doing this in a comprehensive manner, not doing one without the other. And so we, after about a year and a half of doing the research and the sort of the hard work, and really relying on the evidence to design this piece of legislation, I introduced, along with my colleagues, about 21 bills that dealt with those 4 subject areas. And to date, the governor has signed a little more than half of them into law. Some of it's been adopted through regulation, but most of it's done through the legislative process. And so we've been making strides in this area, but at the end of the day, this is a supply and demand issue. If we can knock down the demand, we can deal with the supply side. So the long-term strategies in terms of the right kind of curriculum for young people, but not just that. It's making sure that those who are prescribing this drug understand the implications, and so there's legislation that requires those providers, those who write these prescriptions, to better understand what they're doing, to inform their patients about the dangers of those drugs, but also to knock down the amount of the quantity of the medication that's being provided, if it's necessary at all. And not be the first thing, that's not the default process or the default prescription for someone who's in either chronic or acute pain. So this is a multifaceted way to approach this treatment options, making sure that people have access to inpatient and outpatient care in a meaningful way. I mean, for folks who have this substance abuse disorder, whether it's heroin or prescription pain medication, this is going to be a lifelong struggle for most people. And so that has to be acknowledged. And so we need to provide those kind of resources for those individuals going forward, and even when they relapse, if they do. And then deal with those other issues on the other end, which is the education and prevention side, so that those who write the prescriptions understand the implications, those who receive them, whether they're a minor, so that their parents or a guardian know, or the adults know as well. And so it's a comprehensive approach that we know in some ways is a longer term strategy, which this is going to need long time before we bend the curve. And then there's some short-term things that we can do to try to knock down the amount that's out there.
Prosecutor Coronado, there was a point where law enforcement thought it could lock its way up, arrest its way out of this. What changed?
Well, years ago, when you really looked at the problem, let's take opioids. You know, heroin back in the 70s was probably 23–24% pure. If you look at what we're seeing now, according to the DEA, somewhere around 80–84% pure. So it's changed dramatically, obviously, in the last 35 years. More importantly, it's not only the heroin, but it's the synthetic opioids that has really changed. What I call the synthetic storm has changed tremendously. You take fentanyl that's really come onto the scene. Given some statistics from Ocean County, back in 2014, about 15% of the packets had fentanyl in them. In 2015, it went up to 35%, and unfortunately in 2016, 65% of the heroin had fentanyl in it. That just changed the face. It's a storm that's overtaking taking the substance abuse population. You know, unfortunately, going back to 2015, we had 118 overdose deaths in Ocean County. Now in 2016, we had 209. That's all due to the fact that the synthetic opioids have hit the market and continue to be a tremendous problem. I think that healthcare, I mean, so far as law enforcement is concerned, I think law enforcement has to partnership up with education. I think it's important to prevention and to get into prevention. That's the long-term goal. I think that you need, the second block would be a strong law enforcement, strict liability, going after the predators, the drug dealers. And then I think the third block would be partnering up with healthcare so far as breaking the cycle of addiction. I think law enforcement has to have this new approach if they're going to succeed at all.
You know, part of this effort is to sponsor and hold town hall meetings across the state in different regions to hear from people. You've been kind of on the forefront of this in terms of listening to people in Ocean County throughout the state and paying attention, close attention to the statistics, as you just ran some of those off there, and listening to what's going on, and then responding to that by coming up with programs that have been modeled and copied across the state. And for instance, the Recovery Coach program. Tell us about that.
Well, the Recovery Coach program is something that you could see that that person has walked the walk. That's an individual who usually had a substance use problem and now has recovered. And these people who are currently going through this problem now can relate to that individual a little better. But it's also a continuum of care. The Recovery Coach not only grabs that person, you know, right now we have with the ART program through the RWJ Barnabas Health, and they're able to go into the hospital, and when that person is brought there after being sprayed with Narcan, they can convince that person, since they almost walked into the light, that they can now get into treatment. That's important. And then what they do is they follow that individual. Once convincing that individual that's the right thing to do, and that they follow that individual not through treatment, but then through the recovery process. And now we just turned down Ocean County like the HEART program, which is you can walk into a police station and that you can get help whether you have money, don't have money. And I would say since January 11th, we do it on Wednesdays and Thursdays. We've had 120 people walk into a police station and say, I need help. Instead of going to health care, they've walked into a police station. We've been able to place all those 120 people into some sort of treatment program. So we're proud of what we're doing, but again, it's not in isolation. We need to cooperate. Law enforcement needs to cooperate with prevention, needs to cooperate with healthcare if we're going to be able to get us out of this epidemic.
When you start talking about this crisis, this epidemic that we have, what do you say to people out there? Moms, dads, sisters, brothers, middle class, upper class, lower class, whatever the classification is, who say that this has no impact on me. In terms of me needing to go, wanting to go to a town hall, this doesn't affect me. My so-and-so, my son, my daughter, my nephew, my niece, they're not using drugs. Everything is cool. Well, Doctor, what do you say to that?
I think that you may not know what's going on in your community, but it's there. There's no question that it's there. I think about my youth when I grew up, and I didn't know anybody who really died until I was in my 30s, you know, and that was my grandparents. You know, my kid who just graduated from college, he has high school friends who've already died of drug overdoses, right? So you think about how how that's come to be and what the implications are for the future of our young people living through those sorts of traumatic events early on in their life. You don't know. I mean, these were not, the people that died, these kids, were normal kids, right? And they were the athletes, they were the students. You don't know that they're there. You know, we're talking now about putting naloxone into all of the schools in the state and in the country, in the high schools, so that when the kids that are there, the students, are found unconscious and not breathing, the school nurse or other personnel can administer that antidote to revive them and potentially save their life. I mean, these are the sorts of things that you never thought about when you were young, right? We didn't have to deal with these sorts of issues. But that's how important they are in our communities. And it's not any particular demographic of any community. It's every community, whether it's in the suburbs or the rural areas, if it's in the inner city, if it's the wealthy or the less socioeconomically wealthy areas. I mean, it's everywhere. So right. it's totally invaded our entire life.
Mike, in Ocean County, unfortunately, I had to turn out Narcan in every single high school, so every single high school in Ocean County has it. Wow. And to me, though, it goes back to the family. It goes back to communication. I think it goes back to the family unit. I think people now, because of their job, because of money pressures, the family's constantly in motion. There isn't that communication between a parent and a child. These forums, I think, will help that, maybe foster that communication again. I think that, when people, they don't have an opportunity as a family unit to sit down at the dinner table today to find out what happened, what was going on with that child, what was going on with that family. It goes back to tradition. And as a result of fast communication, everybody being on the cell phone, not everybody being able to talk to each other at the same time, I think the parents lose touch with their child, even though they live with them, as incredible as that may seem. I think that makes a difference. And I think that the forums, will bring attention back to the family unit, say, look, this is what we need to do, and we need to get into the schools, and I think the schools need to year after year, not just 5th grade or just not 9th grade, but year after year, it needs to be in a curriculum so they understand the problem. And I think that that's what this forum and what the discussions that we have here today will make a difference.
Senator?
Well, I think parents shouldn't be fooled that their kids aren't thinking about it or they haven't experimented already. Look, we're old enough to know that when we were young enough, we were experimenting with things, and we were harmless fun with some kids, but it happens all the time. And the numbers are staggering for those who have now a substance abuse disorder who found their very first pill in a medicine cabinet. Because mom or dad have it, it's okay to take, it's safe, but it's also fun for some of these kids. And so literally thousands of young people who are now adults or they've quite not reached adulthood have experimented because they found the very first pill in a medicine cabinet. So the work that the partnership has done in terms of making sure that parents clean out their medicine cabinet, keep it under lock and key. Literally, there are millions of pills sitting in people's medicine cabinets right now. And so as parents, we should know that we shouldn't be fooled that kids are kids and they haven't quite developed the sense of danger and the result of the things that they do. And they will experiment. And whether it's alcohol, whether it's cigarettes, whether it's drugs, and literally thousands upon thousands of young people have developed this addiction to either pills and then segued over to heroin because they found it in the medicine cabinet. So don't underestimate that if you're a parent, that this could happen even to the best kid, the straight A student, the scholar athlete, or the kid who is struggling at home with a family that might be disconnected. It's all the same.
Right. Senator Vitale, Dr. Nelson, Prosecutor Coronado, thank you. Angelo, we'll be right back.
Thank you.
Right back with Angelo Valente and Marianne Christopher. But first, here is another excerpt from a very important video called Moms Know Best.
Pretty much everybody knows someone either in their family or someone close that has an addiction. And it's just like we said, an epidemic, and we have to pay attention.
Because we're losing our children.
At rapid rates. It's just, we need to stop. And we need to make people aware of what's going on.
We're back with Marianne Christopher and Angelo Valente. Marianne, why is it so important for residents across the state to attend one of these town hall meetings?
I think it's so important for residents to come out because it's their voice that we want to hear. It's their perspective that we want to really leverage to take a solution statewide. And we know that every community is different and the issues are different in every community. And we heard, that there are different solutions like being stood up in Ocean County and in other counties. And we want to learn what those solutions are because we have a couple of different opportunities that we think will come from the town halls. To educate, as we've spoken about, but to learn, I think, is the most important, and to frankly change the public attitude about the opioid crisis so people recognize it's a disease and that we all have the responsibility to wrap support around people at these times of great vulnerability.
Angela, we've covered a lot here. How can people find out more about the town hall meetings?
We have a website that we've created where people can register for these free town hall meetings, and it's knockoutopioidabuse.drugfreenj.org.
Angelo, Marianne, thank you very much.
Thank you, Michael.
Thank you, Michael.
You're most welcome. As Angelo says, we invite you to join this conversation because this is an issue that has such a direct impact and a direct effect on so many different families, so many different segments of the population in New Jersey. And it's an issue, as the facts and statistics seem to show, it needs your attention. As both the Partnership for Drug-Free New Jersey and the Horizon Foundation of New Jersey work to knock out opioid abuse.